Coughing is a natural reflex for clearing the throat and lungs of irritants. While an occasional dry cough is rarely a cause for concern, persistent coughing can indicate an underlying medical condition that may be more serious. A dry cough, or sometimes a tickly cough, is a cough that does not bring up any phlegm or mucus. Dry coughs may cause a tickling sensation and are often due to irritation in the throat. Doctors often refer to dry coughs as non-productive coughs. In contrast, a wet, or productive, cough brings up phlegm that helps clear the airways of irritants. Doctors also classify coughs as either acute or chronic. A cough is chronic if it lasts longer than 8 weeks. In this article, we describe some of the possible causes of a dry cough and the treatment options. We also discuss diagnosis, general treatments, prevention tips, and when to see a doctor. Asthma is a long-term lung condition that leads to inflammation and narrowing of the airways in the lungs. One of the most common symptoms of asthma is coughing, which is often worse at night or early in the morning when a person first wakes up. The cough is often productive, meaning it brings up phlegm. However, in a type of asthma called cough variant asthma, the main symptom people experience is a dry cough. Other symptoms of asthma can include wheezing, shortness of breath, chest tightness or pain. Treatment: there is currently no cure for asthma, so treatment focuses on relieving symptoms and preventing future attacks. Typically, doctors prescribe the following treatments for people with asthma. A quick relief inhaler, such as a short-acting beta-2 agonist, for treating symptoms when they flare up. Long-term medications, such as a low-dose corticosteroid inhaler, for reducing inflammation and preventing future attacks. Idiopathic pulmonary fibrosis. Idiopathic pulmonary fibrosis (IPF) is a condition in which scar tissue develops inside a person's lungs. As the scar tissue thickens, it makes breathing in air increasingly difficult. The term idiopathic means that doctors do not know exactly what causes the condition. One of the most common symptoms of IPF is a persistent, dry cough. Other symptoms can include shortness of breath, loss of appetite and gradual weight loss, fatigue, clubbing, or widening and rounding of the tips of the fingers or toes, also affecting the shape of the nails. Treatment: there is currently no cure for IPF, so the aim of treatment is to relieve a person's symptoms and slow disease progression. Treatment options for IPF include medications such as pirfenidone and nintedanib, oxygen therapy, pulmonary rehabilitation, which is a program of exercises, training, and support for people with long-term lung conditions, lung transplantation. Gastroesophageal reflux disease. Gastroesophageal reflux disease (GERD) is a condition where acid leaks from the stomach back up into the esophagus, or food pipe. According to a 2015 review, trusted source, GERD causes a chronic, dry cough in up to 40% of people with the condition. GERD typically also causes a number of gastrointestinal symptoms, which may include heartburn, nausea, vomiting, pain or difficulty when swallowing, bad breath. However, research suggests that up to 75% trusted source of people with GERD-related cough may not experience these gastrointestinal symptoms. This can make it difficult for doctors to diagnose GERD in people with just a chronic, dry cough. Treatment: many people can manage symptoms of GERD through lifestyle changes, such as eating multiple small meals each day instead 3 large meals, limiting or avoiding foods that trigger or worsen symptoms, such as fatty or spicy foods, maintaining a healthful weight, quitting tobacco smoking, reducing or avoiding alcohol intake. Over-the-counter (OTC) and prescription medicines, such as antacids, H2 receptor blockers, and proton pump inhibitors may also help relieve or prevent symptoms. Postnasal drip is when mucus from the nose and sinuses drips down the back of the throat. When the mucus drips into the throat, it can trigger a cough. Although this cough is often productive, it can sometimes also be dry. Postnasal drip often occurs with a sinus infection or due to a nasal allergy, such as hay fever. Other symptoms of postnasal drip may include runny nose, a feeling of something in the back of the throat, sore throat, frequent swallowing. Treatment options for postnasal drip includes decongestants, nasal sprays, and nasal saline irrigation. Upper respiratory infections. Upper respiratory infections such as common colds and the flu can cause acute coughing. The cough often starts out productive but may become dry as a person recovers from the infections. Other symptoms of upper respiratory infections may include fever, muscle aches, runny nose, sore throat. Treatment: a person can usually treat viral upper respiratory infections at home with plenty of rest, staying properly hydrated, and taking OTC medications to relieve aches and fever. A doctor may prescribe an antiviral medication for people with the flu.